I'm about 50, 60 feet away from our resuscitation area, and walk you into our ED simulation bay, which is right here. And this is a spot that essentially we took over because we were walking by and seeing it empty over a couple years after a renovation. And so it was an old ambulance bay. Essentially, we squatted in, and myself and a couple other colleagues went to Home Depot and got a bunch of stuff. We borrowed stuff from around the hospital. These are lights from an old sleep lab, and essentially converted this into a sim lab. And this is about to have a major renovation to become a state-of-the-art place. But really, over the past 3 years, this place has been operating as what we call the ED sim bay. And what's unique about this sim bay is it's in situ, meaning it's 50 feet from a resuscitation area. And that allows us to have multidisciplinary simulation whenever we choose. What's also unique is that we have a clinical cadaver program, and that's what I want to talk to you about here for a couple minutes. There's been a big dialogue on Twitter over the past couple days about how do we gain experience or get good at doing things such as cricothyrotomy. If you want to hear more about that, that's really what my smack talk is about, not about doing crikes, but having high acuity, low opportunity situations, how we manage that. But what I'm here to tell you about is that there's no reason why any place in the world can't have access to what we call clinical cadavers. And what clinical cadavers are people that have donated their bodies to a human body donation program, and instead of being fixated in the traditional way, which renders them very rigid and quite ineffectual, I guess, from a point of view of procedural learning, to a way that they really behave as if they are anesthetized patients. They obviously don't have circulating blood, but the tissue planes are all preserved. And we learned this from Baltimore and Rich Levitan, and we modified the preparation and have been doing this over a number of years. And what we did was, when we took over the sim bay to get proof of concept, we staged a full trauma that the whole province had to respond to, and it was our whole province system had to respond to. It was a gunshot wound to chest. Our trauma team was activated. I had the dean over here. I had the CEO of the hospital here. And essentially we did a resuscitation using the clinical cadaver, and then debriefed it. And really that allowed us to gave us the validity to keep the space and create what environment that continues to be used. Yesterday, this room was full of our flight medics learning on clinical cadavers. So what is a clinical cadaver? Again, what's crazy is that people aren't using these. Anatomy departments are becoming or being considered irrelevant now because people don't learn the same way in terms of dissection. But what happens if you get rid of these departments and access to these cadavers, you're missing this opportunity. And to me, it's the most powerful, unused medical education intervention of the past 50 years. This is a poster that we presented a couple of years ago, but I can't stand it when people call this high-fidelity simulation. This is expensive simulation. High fidelity is simulating the real body, and we can have access to the real body. It's actually cheaper to prepare these cadavers than the traditional fixation technique. So it's really about going, and what I did is I went to our Department of Anatomy head at the time after coming back from Baltimore. I said, you got to go to Baltimore. They went to Baltimore. They learned the technique. And they came back, and 2 days later we're doing it. It's, as I said, it's inexpensive, and it gives you true high fidelity learning for high acuity, low opportunity situations. So really this needs to happen at every academic center, any center that has access to a human body donation program around the world. And there's no reason why this can't or shouldn't happen. It doesn't require any special technology. And what we've done is we've altered the preparation. We call it now the Halifax Preparation, where these cadavers will be preserved for up to 4 weeks. We again keep them in the hospital, and they're used as we need. And our new renovation is going to have a couple of fridges here, so you need to have access to these specimens, and then you won't have the argument of issue, and whether issues have been talked about on Twitter about using plastic versus real tissue. So get on with it. Feel free to email me or contact me about this.